you start off with eczema, then you can develop food allergies, then you can get allergic rhinitis, and then you can get asthma. Now, some kids go through that entire march. Some kids just go eczema, food allergies, and stop. Some kids just do eczema and stop.
Today, we're talking about childhood asthma with allergist and immunologist Dr. Salima Thobani. She is a board certified physician living in Southern California and also practicing in Southern California. So, Dr. Thobani, let's get into childhood asthma. Why do some kids get it? And will they ever grow out of it?
That's a great question. So, there is something called the Asthma Predictive Index. And we look at that to tell us, is this asthma or not? Because between the ages of 0 to 4, we have some children who we call transient wheezers, right? It's just their little lungs and their cavities. They get a little sick. They might be wheezing. And parents will always ask us, like, is this asthma? And we can't really do lung function. We're not doing chest x-rays. We're not doing, spirometry or any of that in this age group. So there was a big study out of Tucson, Arizona that looked at this. Well, if these transient wheezers, what is the likelihood that they're going to have asthma, right, at age 7? And they came up with something called the Asthma Predictive Index. And there are 2 major criterias and 4 minor criterias. The 2 major criteria are family history, so maternal or paternal history of family asthma, or if the child has eczema. And you only need 1. So if I have a child that comes to my office and they had eczema at 3-4 months of age, and now they're 3 or 2 or 3 coming to me and they're wheezing or coughing, that to me is a child that's atopic. There's something called the atopic march. And so you start off with eczema, then you can develop food allergies, then you can get allergic rhinitis, and then you can get asthma. Now, some kids go through that entire march. Some kids just go eczema, food allergies, and stop. Some kids just do eczema and stop. But when I see a patient that has eczema, I prepare the family for these are the potential things that can come about. So that when your child is coughing and everyone's like, oh, they just started daycare, don't worry about it, this is not a big deal. No, that cough in that child is very different because that child had eczema. And this could be potentially asthma.
When does childhood asthma start to show up? Like, when should parents start to be more vigilant about a cough, in a child who has eczema already?
So usually if asthma is going to develop, we see it between the ages of 2 and 3, and sometimes earlier, depending on if they got RSV or rhinovirus in that first year of life. I mean, it's developing asthma is also multifactorial. There are some folks who don't have the family history or don't have eczema, but they got RSV in their first year of life. RSV is a very interesting virus because it's been studied that independent of family history and all of genetics, getting RSV in your first year of life puts you 2.7 times more likely to develop asthma. So we know early on it is messing with the lung epithelium.
And so for these people that actually end up developing childhood asthma, and I'm sure their parents want to know, what will it ever go away?
I get every day when I diagnose a child with asthma, that's what parents are asking us. And so there is no cure, right? But we can control it. We can control it to the point where we are going to have your child be active, playing all their sports, doing PE. We want you to be fully active, normal, healthy kid, thriving child. The natural history of asthma is that sometime during puberty, we used to say it goes away, but we don't. I don't use that. I said it becomes quiescent. It shuts down. It calms down. You'll find that kids come off of all their inhalers. They no longer need anything. But you have to keep in mind that they can later on in life, where I saw patients who were like, I had really bad asthma as a child, and then it went away when I became 13, 14, and I hadn't had any problems. And then I got COVID and my asthma's back, and they're back on inhalers. So it is just that perfect storm where your memory in your lung epithelial is still there. And if you get that right virus in adulthood, your asthma can come back.